When you work, you sweat. When you sweat, you lose water. Like everyone else, you rehydrate with water, sports drinks, and recovery drinks. But can you drink enough during the workday on a hot, humid day to maintain hydration? Maybe not. It takes effort, and here's why. Working in the heat and humidity results in fluid loss at a rate that can exceed what can be replaced during exercise and even for several hours after if you do not maintain proper fluid and food intake. That's the hydration deficit. The longer you exercise, the greater the deficit if you don't maintain adequate fluid consumption before and during exercise. In order to appreciate how this hydration deficit affects your performance, it helps to understand what happens to your body when you work in the heat and humidity.
During exercise, heat dispersion is your body's way of keeping you cool by increasing blood flow to the skin for conductive cooling. Meanwhile, your muscles are like small furnaces that produce heat when you convert fuel to energy. Your brain detects this rise in body temperature and triggers your body's sweat glands. The water that helps cool you down, sweat, comes mostly from the blood, so the end result is decreased blood volume as you dehydrate.
In lay, non-medical terms, the loss of water results in thicker blood.
Welcome, and thanks for taking the time to participate in today's heat stress prevention training. Today we're going to talk about personal and environmental risk factors for heat stress and heat-related illnesses, including what you should look for when it comes to heat-related illnesses and what you should do about it. We're also going to talk about health and safety planning and the hierarchy of controls to help you avoid heat stress situations. Lastly, we'll spend some time talking about emergency response procedures. That is, best practices and having a game plan. So what exactly do we mean by heat-related disorders? Heat-related disorders are manifestations of overexposure to heat. That is, if you spend too much time in the heat and you're not physically prepared for it, you could have a problem and it could be serious. Like what, you ask? Heat rash, heat cramps, heat syncope or fainting, dehydration, heat exhaustion, and heat stroke. This is no joke. You might be thinking, this won't happen to me, but it happens often and could certainly happen to you or one of your coworkers, so it pays to know the signs and symptoms of heat stress, what to do if it happens, and how to keep it from happening. Before we go into the specifics of what to look for and how to respond to these disorders, we're going to take a look at some of the personal risk factors that can impact a person's likelihood to develop a heat-related disorder. If you know what these are, we can take steps to deal with them so that the likelihood decreases. Personal risk factors include degree of acclimatization to working in hot environments, dehydration from not drinking enough water or an illness, poor health, that is, medical conditions such as those that impact cardiovascular function, renal or sweat gland functions, or the body's ability to regulate temperature, a previous heat illness, individual susceptibilities such as age, weight, degree of physical fitness, pregnancy, and medications like those for blood pressure and antihistamines, and recovering from the use or abuse of alcohol or other intoxicants. If you're going to be working in the heat and any of the above apply, you'll need to take steps to address them before you begin work. It may be as simple as ensuring that you have eaten and had enough fluids, or may require you to speak to your physician about what you can do. There are also environmental risk factors, which are high temperature and humidity, no breeze or wind, direct sun exposure, workload severity and duration, radiant heat and air movement, and personal protective equipment worn by employees. Many of these factors are beyond our control as far as that they are occurring, such as no wind on a 98-degree day, but we can use the information in this training, track, JSAs, health and safety plans, etc., to eliminate or mitigate the risk of developing a heat-related disorder. In regard to PPE, in some instances it may be necessary to evaluate the risk of not wearing some type of PPE versus the risk of the PPE increasing body temperature. If it's determined that the risk of using PPE will increase the risk of heat stress, work with your project team or health and safety to come up with a workable solution so all hazards can be addressed. For example, using a mesh Class II safety vest rather than a heavier fabric vest, or using a cooling vest, taking more frequent breaks, or delaying the work until the weather is more conducive to work. We're now going to discuss the various heat-related disorders, what the signs and symptoms are, what to do if they occur, and how to avoid them. For all, when we talk about using electrolyte-type fluids like Gatorade or Powerade, and increasing foods with sodium or potassium, please first consult with your physician about what you personally should do if you have any special dietary needs or have any ongoing medical conditions. In addition, for all, adequate food and liquids is critical, as is avoiding liquids that contain alcohol or caffeine, because they can cause further dehydration, making conditions worse. Heat rash is the most common problem in hot work environments and is caused by sweating. It looks like a red cluster of pimples or small blisters. Heat rash usually appears on the neck, upper chest, in the groin, under the breasts, and in elbow creases. The symptoms of heat rash include itchy skin and skin eruptions and reduced sweating. For heat rash, the steps you take to treat heat rash are really the same steps you take to prevent it from occurring. Keep the skin clean and periodically allow the skin to dry. This is the most effective method of prevention. Reduce heat exposure, such as taking more frequent breaks in a cool area and wearing breathable fabrics. You can also use powder to increase comfort. Keep in mind, ointments and creams should not be used on a heat rash. Anything that makes the skin warm or moist may make the rash worse. Heat cramps are caused by an electrolyte imbalance that can be due to prolonged sweating without adequate fluid and salt intake. The symptoms of heat cramps include painful muscle spasms during or after physical activity. Usually it involves the lower leg, calf, and hamstring muscles, but the abdomen could also be affected. If you think you or someone else has heat cramps, stop the activity and move to a cool place. Stretch the cramped muscle and remove excess or tight clothing, and drink water or a sports drink, unless the person is not responsive. Contact work care whenever you have a question or if it's known that the person has heart problems, is on a low-sodium diet, or if the cramps do not subside within 1 hour. To prevent heat cramps, workers should be sure to eat, drink water, and drink sports drinks that replenish body electrolytes. Heat collapse or syncope is caused by the pooling of blood in the legs and skin from a prolonged static posture in the heat. Symptoms include blurred vision or transient dimming or haziness of vision, and or fainting or near fainting behavior. Keep in mind, with heat collapse, body temperature may be normal. If someone faints or nearly faints, have the person lie on their back in a cool environment. If responsive and not nauseated, give water or a sports drink. And call work care to ensure that no other medical attention is needed. To prevent heat collapse, flex leg muscles several times before moving and stand or sit up slowly.